All right, let's dive in. Today we're exploring psychoanalytic and psychodynamic therapy.
A great choice for a deep dive.
I think so too. It's a
Yeah.
topic a lot of listeners requested, actually.
It's definitely fascinating stuff. Complex, but fascinating.
Absolutely. And to really get into it, you sent over some chapters.
Yes, one focused on Freud, classic psychoanalysis, and another looking at alternatives that came after.
Exactly. And we even have some real-life cases to help illustrate how this all works, in practice.
I love using cases. Makes it so much more relatable, don't you think?
For sure. So we've got Karen, a nursing student who starts having these sudden headaches and making errors at work, specifically on this one ward, 3 South. Turns out it's the same name as the ward her father died on when she was a kid.
Wow, what a powerful example of how the unconscious can influence us, even when we have no idea. Like she'd completely buried that memory, but her body was holding on to it.
That's what's so mind-blowing about Freud, right? This idea that we're driven by forces we're not even aware of.
Totally. It was revolutionary at the time, and it's still relevant today.
So let's start with Freud himself, yeah. I mean, who was this guy who dared to delve into the depths of the Victorian mind, like all those taboo subjects?
Well, he was definitely ahead of his time. Initially, he was really interested in these cathartic recollections, how simply recalling and processing traumatic memories could be therapeutic.
That makes sense.
But he realized it wasn't enough. Like, true lasting change needed more. It needed an understanding of the dynamics at play, those psychological forces within us.
So it's not just what happened, but how it's still affecting us.
Precisely. And that's where his personality theory comes in. Those terms you've probably heard: id, ego, superego. Think of them as, think of them like characters in your internal drama always interacting.
Okay, drama I get. So break it down for me. Who are these characters?
Okay, so you have the id, the impulsive one.
Hmm.
It wants what it wants when it wants it, pure pleasure seeking.
Like a little kid, right? No patience.
Yeah, exactly. And the ego is the one trying to manage all that, keeping things in check with reality.
The voice of reason?
Trying to be.
Mm.
And then there's the superego. That's our internalized moral compass. All the rules, the shoulds, the oughts.
So it's like this constant battle between I want it, I can't have it, and I shouldn't want it anyway.
Pretty much sums it up. And Freud believed this interplay, especially those unconscious desires of the id, shaped who we are.
Like Karen, right. Her headaches weren't a conscious choice, but a way for her psyche to cope with that trauma she'd buried.
Exactly. Yeah. Now, Freud also proposed these stages of personality development, each with its own focus, its own challenges. You've heard of them, the psychosexual stage.
Oh yeah, oral, anal, phallic. They always sounded a bit intense to me, even for Freud.
The names can be a bit much, but they describe how our focus shifts as we grow. The oral stage, it's all about the mouth, right? From birth to about 18 months. Sucking, biting, exploring the world through taste.
Makes sense.
And it's about dependency, getting those basic needs met. If those needs are consistently frustrated, Freud thought it could lead to certain personality traits later on. An oral personality, maybe overly dependent, pessimistic, fixated on oral activities, like think smoking or overeating.
Interesting. So our adult quirks might be rooted in how we navigated being babies. That's kind of wild.
Right. Then comes the anal stage, around age 2 to 3. Toilet training, right. So it's about control over our bodies, but also in relation to authority. Conflicts here. Could lead to an anal personality later on. Rigid, maybe obsessed with order, or, the flip side, messy and defiant.
I'm definitely seeing some of these types in my life.
Right. Now, next is the phallic stage, ages 3 to 6. This is where kids become aware of their genitals and start to experience some complicated feelings towards their parents.
Okay, so this is where we get to the Oedipus and Electra complexes.
Yeah.
Honestly, those always seemed a bit much for me.
They're often misunderstood. It's not about literal desire for a parent, but more about the child's developing sense of self in relation to them, like navigating those early feelings of love, rivalry, identification with the same-sex parent. It all factors into how we form our sense of ourselves as men and women.
Wow, so much packed into those early years.
Right. And then things calm down a bit during the latency stage from about 6 to puberty. Kids are focusing on social skills, learning, hobbies.
Sounds like a welcome break from all that drama.
And bam, puberty hits, and it's the genital stage. Those sexual desires reemerge, now directed towards appropriate partners. It becomes about mature relationships, intimacy, love.
So this is where it all comes together, hopefully.
In a perfect world, yes. It's about integrating all those earlier experiences to achieve a healthy and fulfilling adult life.
What a journey. And this is all crucial to understanding how Freud viewed psychopathology, right? Like, how things go wrong in this whole process.
Exactly. He believed that fixations at any of these stages, due to unresolved conflicts or trauma, could manifest as specific personality traits or patterns of behavior later in life. And these fixations, coupled with the overuse of those defense mechanisms, well, they could lead to neuroses.
Oh yeah, defense mechanisms. Those are key.
They are. They're like our psyche's little protectors. Imagine them as unconscious strategies to manage those internal conflicts we've been talking about. You've got repression, denial, projection. They help us cope, but if overused, they can really distort reality.
Right, so if I'm always repressing anger, it might come out in other ways, right? Like passive aggression or even physical symptoms like Karen's headaches.
Exactly. And this is where understanding the unconscious becomes so crucial. Our symptoms are often like symbolic messages from our psyche. It's not just what we're aware of, but what's going on beneath the surface.
Like our psyche is speaking in code, and psychoanalysis is about deciphering that code.
Perfect analogy, and that's what we'll dive into next. How the actual process of psychoanalysis tries to address these issues by bringing the unconscious into awareness. It's a fascinating journey. So before we jump into how psychoanalysis works, in practice we were talking about those defense mechanisms.
Yeah, they're fascinating, aren't they? Like, we all use them to some extent.
We do. It's just that some people, well, they become a bit too reliant on them.
Right, like their go-to coping strategy, even if it's not actually that helpful in the long run.
Exactly. And thinking back to Karen's case, it makes me wonder if her headaches weren't a form of, what's it called, somatization?
Somatization, is that where psychological distress, turns into physical symptoms?
You got it. It's like her body was expressing what her conscious mind couldn't quite process.
Wow. So Freud was onto something with this whole unconscious thing.
He really was. He saw it a lot, actually. The unconscious finding ways to express itself through dreams, slips of the tongue, even, physical symptoms like Karen's.
Okay, so psychoanalysis aims to make the unconscious conscious, right?
Mm-hmm.
But how does that actually happen? What goes on in those therapy sessions?
Well, it's not about hypnosis or mind control, despite what some people think. It's more about a process of guided self-discovery, really. Often, the patient is lying on a couch, to encourage relaxation and introspection.
The classic couch, I always picture that.
Right. And then they're encouraged to engage in free association.
Free association, so just letting your mind wander and saying whatever pops up.
Pretty much. It sounds easy, but believe me, it's much harder than it seems.
I could imagine. It takes a lot of courage to, let go of those filters and just say whatever's on your mind.
It does, and the analyst listens carefully, not just to the words, but to the gaps, the hesitations, the topics the patient might be avoiding.
So it's like a detective story, where the clues are in what's not being said.
You got it. And then there's transference. This is when the patient starts projecting feelings and expectations from their past, often from relationships with parents onto the analyst.
Ah, I've heard of this. So if someone had a critical parent, they might start to see the analyst as critical, even if the analyst is being totally neutral.
Exactly. And that transference, it's gold for the analyst. Provides a window into those unconscious dynamics. The analyst can then help the patient recognize these projections and understand how they might be playing out in their current life, relationships, work, all of it.
Wow, so the therapy room becomes a sort of microcosm of the patient's inner world.
That's a great way to put it. It's a safe space to explore those deep-seated patterns and, hopefully start to change them. The analyst isn't there to judge or give advice, but to act as a guide, a facilitator of self-discovery, really.
That makes sense. It sounds like intense work, though. I've heard psychoanalysis can take years, right?
It can, yes. It's not a quick fix, that's for sure. It's about deep, lasting change. And that takes time, commitment from both the patient and the analyst.
Right. And speaking of different approaches, we have Max's case, the pre-med student. He seemed different from Karen, right? Like less about repressed trauma, more about this intense ambition.
You're right. Max's case is a great example of how classical psychoanalysis isn't always the best fit. He needed something a bit more, focused, maybe.
So less about digging into childhood, more about addressing those current struggles.
Exactly. And that's where psychoanalytic psychotherapy comes in. It's often shorter term, more goal-oriented, tailored to the individual's needs.
So less couch time, less free association for years on end.
Yeah, think of it as psychoanalysis, but maybe a bit more streamlined, adapted for the modern world, you could say. It's still based on those core psychoanalytic principles, but in a more flexible, adaptable way.
Okay, I'm getting it.
Yeah.
And what about relational psychoanalysis? That one always seemed interesting to me.
It is. This approach, it shifts the focus from internal drives to the way our early relationships shape how we see the world, how we connect with others.
Right. So thinking about Max again, his fixation on achievement, it could be rooted in his early relationships, maybe a need to prove himself to a parent or something.
Exactly. Relational psychoanalysis sees the therapeutic relationship itself as a key part of healing.
Interesting. How so?
Well, the therapist isn't just this blank slate. They're a real person who brings their own subjectivity to the interaction, and that allows for a deeper exploration of how the patient relates to others.
Okay, so it's less about interpretation and more about creating a new experience in the therapy room.
You got it. It's about creating a healthier relational experience within the therapy that can then, hopefully, be applied to the outside world.
I see. That makes a lot of sense. Now, we also have Lacanian analysis, which honestly always seemed the most mysterious, I guess.
It's definitely the most complex of the bunch. Lacan, he was a French psychoanalyst who built on Freud's work, but took it in a very philosophical, even linguistic direction.
Linguistic. So language plays a big role here.
Huge. Lacan believed that our unconscious is structured like a language. Our symptoms, our slips of the tongue, even our dreams. They're all forms of communication from the unconscious, expressed through symbols, metaphors.
So it's like our psyche is a poet, and the Lacanian analyst is the literary critic.
I love that analogy. That's a great way to put it. Lacanian analysis is all about deciphering the language of the unconscious.
Fascinating. And they use variable length sessions,
Yeah.
which can be super short, like just a few minutes sometimes.
Yeah. It's all about disrupting expectations, keeping the patient on their toes. It's about encouraging them to confront the truth of their desire, what Lacan called jouissance. It's a complex concept, but basically it's that which is beyond the pleasure principle, a kind of, excessive enjoyment that can be both pleasurable and painful.
Wow. Okay, I'm sensing Lacanian analysis is not for everyone.
You're probably right about that, but for the right person, it can be incredibly insightful, even liberating.
Okay, so we've got all these different approaches, each with its own, flavor and focus. But let's be real for a second. Does any of this actually work? There's been a lot of debate about the effectiveness of psychoanalysis and all its variations.
You're right. It's a question that comes up a lot. For a long time, psychoanalysis relied mostly on case studies, anecdotal evidence, which isn't always enough to satisfy, the scientific community.
Yeah, I can see that. So how has the field responded to that criticism? Have there been attempts to study these therapies more rigorously?
There have been. It's tricky, though, because psychoanalysis is so individualized, often long-term, so controlled studies are hard to do. But naturalistic studies, where you're observing patients in real-world settings, those have shown some promising results. For instance, there was this meta-analysis of 14 naturalistic studies on psychoanalysis, and it actually found a large effect size.
Large effect size. So that means people are actually getting better.
It suggests that yes, but you're right to be cautious. Without a control group, it's tough to say for sure that the improvement is due to the therapy itself. It could be other factors, right? Maybe just having someone to talk to, regardless of the approach.
Right. Makes sense. What about psychoanalytic psychotherapy? Has there been more, controlled research on that?
There has. And the findings are more, I'd say, robust. One meta-analysis of 27 controlled studies found a success rate of 64% at the end of therapy, which suggests it's effective for a range of issues.
That's encouraging. But how does it stack up against other therapies that are often seen as more, evidence-based, like CBT, for example?
It's hard to do direct comparisons, to be honest. Some studies show they're equally effective, while others give CBT a slight edge, especially for things like anxiety and depression.
So the best approach depends on the person and what they're struggling with.
Exactly. It's not about one therapy being superior. It's about finding the best fit. And sometimes, integrating different approaches can be the most effective strategy.
Integration, yeah. Taking the best of different worlds. But even with more research, psychoanalysis still has its critics, right? What are some of the main concerns that people bring up?
Well, yeah, aside from that whole research question, one criticism is that it can be too focused on the past. Critics argue that dwelling on childhood can actually keep people stuck instead of helping them move forward.
Yeah, I can see that. Yes, my past matters, but it shouldn't define me, right? I still have choices to make now.
Absolutely. Another common critique is that it can feel a bit too deterministic. It's saying our behavior is determined by these unconscious forces, which, some people feel like that undermines free will and personal responsibility.
It's a tricky balance, right? How much are we really in control of our own lives?
That's the million-dollar question. And it's something that contemporary psychoanalysis is grappling with. It's less about saying the past dictates the future and more about understanding those influences so we can make more conscious choices.
So it's about awareness, not just determinism.
Exactly. And then there's the critique that traditional psychoanalysis is a bit too rooted in Western values. It was developed in a very specific time and place, and it doesn't always translate well to diverse populations.
Right, the image of the patient on the couch, bearing their soul to a silent, usually male, analyst. Not exactly the most inclusive image.
I hear you. And the field I is trying to change that. There's a push for more diversity, more therapists from different backgrounds, more sensitivity to cultural differences, and a move away from that hierarchical dynamic.
That makes sense. It's about recognizing that everyone's experience is unique, shaped by so many factors, not just those internal conflicts.
Precisely. And that brings us to the future of psychoanalysis, which I think is pretty exciting, actually. It's not about clinging to outdated ideas, but about evolving, integrating new knowledge and perspectives.
So less Freud on a pedestal and more taking the best of what he offered and moving forward.
Yeah, exactly. So psychoanalysis, it's got to keep adapting to stay relevant.
Right. Okay, so future of psychoanalysis.
Yeah.
Where do we even start?
It's tough to say for sure, but one thing's clear. Like, that old school dogmatic Freudian approach, it's on its way out.
Yeah, which honestly is probably for the best, right?
I think so. But
Yeah.
those core insights, they're still gold. Like the power of the unconscious, the way relationships shape us, that need to go deep, explore ourselves, that stuff's timeless.
Totally. So it's about finding ways to apply those insights to, like, the world we live in today, yeah.
Exactly. It's not about putting Freud on a pedestal. It's about taking those gems he uncovered and, well, polishing them, refining them, making them work for us now.
I love that, polishing those gems. So what are some examples of, like, how that's already happening?
Well, we talked about neuropsychoanalysis. That's a big one. I mean, actually seeing those unconscious processes in the brain, it's mind-blowing.
Right, like giving those abstract Freudian concepts some real tangible evidence.
Totally. And then there's relational psychoanalysis, that shift towards empathy, connection. It's speaking to a lot of people.
It feels very current, doesn't it?
It does. And then there's the whole integration thing, blending psychoanalysis with other therapies, taking what works from each.
Like mixing it with CBT or mindfulness. That makes a lot of sense.
Right. It's about creating something that's truly tailored to the individual. No one-size-fits-all approach.
Right, it's about finding what actually helps people, not just sticking to dogma. But, we did talk about those criticisms, right?
Yeah.
Lack of scientific evidence, the focus on the past, all that.
Yeah, they're important to address, like the whole evidence thing. I mean, yeah, some of those Freudian concepts are tough to prove.
Especially the more out there ones.
Right. But hey, the field is getting better, engaging with research, trying to test those ideas, not just accept them blindly.
Like those studies showing neural correlates for things like repression. That's pretty huge.
It is. Shows there might be something to those ideas, even if we need to update the language, the interpretations.
Okay, so what about the past-focused thing? Like, some people feel it's too deterministic, right?
I get that. But I think the shift towards relational psychoanalysis helps address that. Yes, early experiences matter, but it's not about blaming our parents or feeling trapped.
It's about understanding those patterns so we can break free, right? Make different choices.
Exactly. It's about awareness growth, not just dwelling on the past.
And then there's that whole cultural bias critique.
Yeah.
Traditional psychoanalysis, I mean, it was very much a product of its time, wasn't it?
It was. And that image of the Stern Viennese doctor analyzing the anxieties of the wealthy, not exactly relevant to everyone's experience.
Especially today. So is the field changing that?
Trying to, definitely. Like more emphasis on cultural sensitivity, understanding how race, gender, sexuality, all those things play a role, and more diversity among therapists, which is huge EE.
Yeah, being able to relate to the person helping you, that makes a big difference. Okay, so big question. Future of psychoanalysis. Is it dying out, or is there like a revival happening?
It's hard to say for sure. But I think it's at a crossroads. The old way of doing things, it's fading. And that's probably good. But the core of it, that potential to understand the human mind, the depths of our experience, that's still incredibly powerful.
It's about adapting, evolving, right?
Exactly. And we see that happening all the time. Neuropsychoanalysis, relational psychoanalysis, integrating with other approaches. It's a field that's constantly pushing boundaries.
I mean, that's exciting. So maybe the future of psychoanalysis isn't about knowing exactly what it'll become, but recognizing that it'll keep changing, growing, surprising us.
Absolutely. It's about being open to new discoveries, new ways of understanding ourselves. Who knows what the future holds?
That's a great point. We've only just scratched the surface here, but wow, this has been a fascinating deep dive. Huge thanks to you for sharing your expertise. It's been amazing.
It's been my pleasure. Always happy to talk about this stuff.
And to all our listeners, thanks for joining us. Keep exploring, keep asking those tough questions, and most importantly, stay curious about the amazing complexity of the human mind. Until next time.